Hi everyone, I'm Dr. Roxana Eubanks, or Rox the Doc, and if you've been following my page for a while now, you'll know that I am a clinical psychologist that does disability assessments for veterans. And so I've been posting a lot of educational content on C&P or compensation and pension exams and what you can expect that process to look like. And so on one of my videos, I received this really important question, and this person's asking, can you please do a video about PTSD due to MST? And so since I don't want to get flagged by TikTok, I'll try to just sound it out. So MST, for those who don't know, stands for military trauma, okay? And so this is a specific C&P exam that takes place that is slightly different from a traditional PTSD exam. All right, so with any PTSD claim, you're going to submit a statement in support of your PTSD claim. And in that statement, you're going to talk about the traumatic experiences that you experienced while you were in the service. And if possible, you're going to try to give a timeline. So the years, the month or the year the event took place, the location, if you can remember, if it was reported, things of that nature. All right, and when it comes to MST, the VA wants even more information, which is really difficult, especially since it's so hard for anyone to talk about these things, especially to a stranger for the first time. And so in my interviews, I always like to reassure people right away that while we will talk about those traumatic experiences, we don't have to go too in depth if they're not comfortable. And so the VA even makes it a point to teach us providers that you should only ask as much information as is necessary for you to write your report and for it to make a successful connection to their military experience. So by that I mean we don't ask any unnecessary details. We don't need to go too in depth or draw it out more than we need to. And so usually we'll confirm what you wrote in your statement in support. And sometimes people don't include a statement in support, and so then we have to ask a bit more information. And so I'll just confirm some details. I can use more general statements, more vague statements, if I can tell that person is uncomfortable or they are like reliving those memories in present time. And so I confirm the details, like I said. I ask roughly, do you remember around what year this happened? Where were you stationed, or where were you deployed at the time? Was it reported to anyone? And before I ask if it was reported, I typically tell folks that, most MST goes unreported due to the stigma and the fear of consequences. And so if you didn't report it, that is completely normal and understandable. And even actually in our reports, there's a separate section. So you have the stressor, which is the traumatic experience. And then after that, they're called markers. And so markers are, all right, after the traumatic experience, what were the changes that were noticeable? Was there an increase in substance use? Did that person go get STI tested? Did they start going to counseling? Did their work performance reduce or drop significantly? Did they get in trouble? Did they get kicked out of the military? Were their family reporting changes? Was there a breakup or divorce? Any changes that were visible for the individual after the traumatic event, as well as internal changes. So were they starting to feel more depressed, substance use, things of that nature. And so even though we have that marker section in our report, we will also write there that, okay, the research shows that MST often goes unreported for A, B, and C. And so even if you don't have those changes in your STRs or your service treatment records, do not worry, because your provider will be including that in their report. All right, and so I think that answers, or that gives a brief description about what you can expect in a C&P PTSD MST interview If you have any questions, let me know, but I understand how difficult it is to talk about these things. And also, you have an option to request your examiner to be a certain sex, so female or male, if you're more comfortable with that. So keep in mind, okay?